When you're breaking a chicken wing, that's
yeah, it's like a horror movie. You were like in the
It's like cracking an egg, but 10 times louder.
and tape them back together.
Oh my gosh, we're back.
So, well, yeah, when bones break, the cartilage and everything will grow. That takes a while. So I'm on one of these 2-step chairs, right? And the nurse comes by and she goes, "Sweetie, I think you need to sit down." It must have been white.
Or green.
Yeah. So she helps me off the little stool thing, and I think, I'm just going to come back later.
No kidding.
Out of that room.
And anyway, so then they do the open, so they open it up, and they'll use slurries and stuff, and they'll disconnect the heart, or they'll stop the heart, and then they do all of this. And then they'll wire the bone back together, and then they'll sew you up. Now, 5 hours after this, yeah, or staple you, and 5 hours after this, you're in the ICU, intensive care, and now they've got your bed going up to where it's slowly into a lounge chair. It is the coolest thing. There's buttons all over the place, and of course, you know, I'm like, this is cool, look at this. You know, my husband's saying, don't touch anything, don't touch anything. I can just see, you know, the old...
Those chairs will they can actually stand up too.
Stand straight up. Stand straight up. These are the... because the movement, the sooner we can get movement going, the faster the body starts healing. Anyway, let's get back to the point. They're discharged 7 days. 5 to 7 days.
And then walk out, or they're wheelchaired out?
Well, you're always wheelchaired out for legality issues, you know. But it took them a while, but no, yeah, you can. And they make these little tiny heart pillows, the volunteers. And you know how, like, when you hurt yourself, if you hold it and give it a little support, it helps. So open heart patients will use a pillow. And, yeah, they recover from home that way. But, you know, it is. It is kind of cool, but it's kind of a weird thing. If you work in a hospital, technicians do floor stock inspections, and it can be quite fascinating in the ER. In the ER as well. First time you see a dead person, that affected me. It really did.
I don't want to see the blood. All the blood gets stuff.
No, I don't like that either.
I can deal with the sounds. So I can.
No, I did.
Deal with the.
I think it was
dead people.
Huh?
We're gonna see dead people.
Not usually. Not usually.
First day of the job. I see a dead person.
No.
I see a carcass.
Not usually, because most of the time
My first day of work.
they
Instagram.
have a lot of these automated
Take a
dispensing
picture with it like
machines.
this.
Okay, now the automated dispensing machines in a surgery, you're going to have what they call the sterile spine. And this is going to be a hallway, and then these are your operating rooms that go off of the sterile spine. So you're going to be in the sterile spine checking 3 or 4 of these, where you're very seldom ever going to be inside the actual operating room. Now, when we talk about sterile environments, we've come a long ways. Is it really necessary to have people in an operating room that don't need to be there? No.
Do they have those like rooms where you can like see
Some of them do in teaching hospitals. In teaching hospitals. You know, I was really fortunate too. I think it was like, you know, maybe 3 or 4 months later, I was back up in surgery again. And I was in the sterile spine. And of course, there's all these windows on the outside of the operating room. And I was like, the operating room that I wanted to go in, they said, well, they'll be done in about a half hour. It's a short surgery. And I walked over to the window and I was like, gee, I wonder what they're doing. And there's a whole bunch of them, and I could tell it was in the abdomen area. And then the guy sticks his hands in. And it's like, I'm like, oh. And then out came a baby. So it was a C-section that I got. So I was like, oh, a baby. Yeah, so, I mean, you do get to see some interesting things.
That'd be weird to see.
But you don't have to,
C-section.
don't be afraid, don't be afraid at the hospital.
Boom, that's a
When
patch.
you
No.
die, can you donate your veins?
Yeah.
Can they use it?
Um,
I don't
For
know.
research and teaching and stuff like that.
Yeah,
They
for-
like to give you your own, is what they want to do.
yeah, in that aspect, some people can donate their organs or they donate their bodies.
I'm an organ donor.
And when they donate